Well, doctors from the Medical Center Navicent Health held a news conference to discuss the differences between COVID-19 and the flu. 41 NBC's Peyton Lewis has more on what signs to look for.
Respiratory illnesses often present in a very similar way.
Medical professionals are trying to clear up confusion as we head into flu season this year. To most people, symptoms of the flu and COVID-19 seem pretty similar, but doctors at Navicent say there are differences. Dr. Jeff Stevens, the director of infection prevention, says the time it takes you to feel sick could be a key indicator of which virus you have.
But classically, flu is a more abrupt onset so far, as trying to compare that with COVID-19. And the other thing for COVID-19 that's maybe a little more specific to it is the loss of taste and smell.
Dr. Stevens says the real trouble begins when people start spending less time outside and coming together inside when the weather cools off. People being grouped together indoors could become one of the main sources for the spread of both coronavirus and the flu. Rachel Faulkner, Assistant Vice President of Quality and Safety at Navicent, says people should get vaccines this year to avoid a more severe case of flu that could be mistaken for COVID-19.
It still can provide some protection. There's been studies that have shown that it reduces the severity of illness or how sick you get.
Although deaths from the flu are higher than COVID deaths, Dr. Stevens says people typically die from the flu while battling other illnesses. He says people contract pneumonia or bronchitis while their immune system is busy fighting the flu. Faulkner says the same practices that prevent the flu, in addition to mask wearing and social distancing, should keep everyone safe this year.
The same good habits that we use to prevent the flu will also help us prevent COVID and vice versa.
In Macon, Peyton Lewis, 41 NBC News.
And doctors say continuing to practice CDC guidelines and avoiding others who are sick could save you a confusing emergency room trip.